So today we're going to work with French laboratories, Laboratoire Genevrier, and we're going to speak about the, the product called Esteem. So it's a very cool product, and today we're going to work with a beautiful patient called Rachel. And Rachel wants, it's the first time for her, it's the first treatment, aesthetic treatment, so we're going to see what she wants. And she wants to treat her nasolabial fold. This is her demand at the beginning. She only wants this treatment. But we're going to see in the same time it's very important to treat the cheek, the malar fat pad. We're going to see the marionette lines too, and maybe the superior lips, because we're going to see with the hedging we have an increase of the white lips, and with this patient she has a tattoo, so it's not very true. So we're going to see her tattoo and to sculpt the superior lips. It's very important to put some just few volume on the lips and to sculpt the Cupidon, l'arc de Cupidon and the philtrum to have a natural effect. So the Laboratoire Genevrier is a French laboratory, and we have a French aesthetic touch. We want to treat this patient with a lot natural. She don't want to look like a popcorn smile.
Dr. Jonathan, you can start if you want.
Okay,
Yeah.
thank you. So we're going to start. Can you sit, please? Pouvez vous asseoir? So I think the most important is to start is to sit your patient, because when the patient is sit, we can see differences, okay, and the volume. So the first treatment is to treat, the first indication is to treat this nasolabial fold. We can see a loss of volume on the cheek, on the malar fat pad, because with the hedging we have apoptosis of the spots. So the first treatment is to inject in this part very deep on the bone contact, on the soothe under the muscle. It's very important to inject under the muscle on the bone contact to have a pillar, because we want this effect. We want to have a pillar to decrease the nasolabial fold. So the first point is under the pupil, just on the right, because you know, and we know, we have a nerve. Okay, the 5-2. It's very important to avoid this nerve. The first injection will be there, and we can take the arcus and to make another point here, another point here. During injection, we're going to do like a lift to put our product on this point precisely. Okay, and we're going to do the same on the other side, under the pupil, just on external here, another point 2 centimeters, and another point here. So we're going to find like a lift effect to put some volume on this part, on the bone contact. After, we're going to treat this part. It's very important to treat this part on the nasolabial fold, the piriform effect, because we're going to play with the light. It's very important to play with the light, because when you're going to put some volume on this part, we're going to decrease the effect, the bad effect of the nasolabial fold. So it's very important to know in this part we have the facial artery. So we're going to see, I prefer to use the cannula, because when you use a needle, you can put your needle in the artery. And if you put your needle in the artery, you can inject in the artery. And if you inject, we can have a coagulation between the product, the acid, and the platelets, and have some microembol. And we can have skin necrosis. It's very rare. But, you know, if you inject in the artery, you're going to put some problem in the microvascularization. So I prefer to inject the cannula. So we're going to make just a little hole here and here on this part of the nasolabial fold. We're going to cut fibrosis here to have a better effect. And after, we're going to inject on the bone contact under the orbicularis muscle here to improve our result. And after, we're going to inject in this part more superficially to improve our results. With the same point, we can treat the superior lips and the marionette lines. in this part, it's very important to make injection here to have a support. Marionette lines here are not very incredible, but it's very important to prevent the apparition. Not a lot of products. If you put a lot of product, we're going to have a bad effect. So just a few products here and the bolus on this part to treat this part, the chin, okay? So with the same hole. And after, we sourire. Encore. Voilà. When she smiles, it's impossible to see the teeth. So we're going to put some lots, just a few volume here. Not volume, but we're going to see the products on this part and to sculpt the lips. So we're going to start. Vous allongez.
Dr. Jonathan, I think you can start with the demo.
Yeah.
Because we have like 15 minutes to go.
Okay, thank you very much. I'm starting. So my first treatment is the volume. So we're going to work with 3 products today. The volume, and this name is volume, so it's to put some volume. With intense, it's more volumizator than soft, and we're going to treat the nasolabial fold. And at the end, we're going to use the soft to sculpt the lips. So first treatment, je vais prendre le volume. First treatment is volume with l'aiguille. On va prendre l'aiguille. With a needle. So our draw is very important. We're going to inject in this part. We're going to avoid the nerve, the infraorbital nerve, and to put 0.2 milliliters. Okay, thank you. Je vais compresse.
Meantime, if anyone wants to ask any question.
Okay, ça va. Je vais piquer. So, directly 90 degrees, directly on the bone contact. Ça va? Okay, I have a bone contact. And I'm going to inject. Maybe it's not necessary to make aspiration because you know the hyaluronic acid is more strong than the blood. And we're going to put 0.2 units. Ça va? Okay. And we continue. It's better to do a lift effect, to put our product under the skin, under the muscle, on the bone contact, and when we're going to release the skin, we're going to have a lift effect.
Dr. Jonathan, what is the longevity of this product, what you're injecting?
Sorry?
What is the longevity? How long does it last?
The product,
Yeah.
it's around, the studies show that we have a good effect during 18 months. 18 months, but it's like a volume, so we're going to have a good effect during 1 year minimum. We're going to do the same on the other side.
I'll just suggest that you can complete on one side because we have, less time.
Yeah, okay. So I'm going to treat this part. So on prend l'aiguille. So I'm going to do the nasolabial fold. So the first thing to do is to make a hole on the inferior parts of the nasolabial fold. We're going to take the time to put it on this part, and with the same hole we can treat this part, we can treat the marionette lines, and we can treat the superior lips. So, je vous pique. Ça va. Okay. Make a hole, take the time, turn around to make a very good hole, and at the end you can just cut the skin like this. Prendre la canule. Now I'm going to take the intense. It's not the product. Less volumizator than the volume. And the first treatment is to cut adherences on this part. Thank you. first treatment.
So what is the size of the cannula?
The size of the cannula is 25 gauges. Because I love this cannula because it's stronger than 27, and we can do a lot of things with this size. So I'm going to treat this part, ça va? And cut my adherence. I'm superficial. I'm up the muscle, and I'm going to cut my adherences. This treatment, I think, is a better treatment for the nasolabial fold because we're going to cut adherences and have a good effect. Ça va? This part is more painful. Now I already cut my adherences, and I'm going to put my cannula on the bone contact on this part to make a bolus. I prefer to use cannula than needle in this part to avoid the arteria. And now I'm going to put my bolus. .2 of intense. Okay, and after, I can inject in retrograde on the rest of the nasolabial fold. Are you okay? So we can see a good effect now. It's like a bolus with a needle without the risk. We can use the needle, but I think it's better to avoid any risk in aesthetic. With the same point, we need to treat this part of the marionette line, so I can use the same hole and just turn my cannula. And to put just a few products here to have a pillar of the external commissure. Generally, it depends, but 0.3 or 0.4. It's a good solution.
Dr. Jonathan, there is a question from the audience.
Yeah.
What is the brand that you are using?
Sorry?
He's asking what is the brand you are using. I mean, which company product. So that is Laboratories Geneva, right?
Yeah.
And what is the product that is intense you are using?
It's intense, yeah. It's less volumizated than the volume. It's intense. It's the third. We have with Yalogen. We have 4 categories of treatment. The first treatment is volume. We have the intense. We have the global and the soft. Global and soft are very good treatment for the lips. And if you want to make a few volume without any expansion, without any hydrophilia, you can use the intense. I think the intense is a very good treatment for the nasolabial fold when you have a good nasolabial fold, but it's very cool. So we treat this part, and now I'm going to put just a few products here to optimize this part. Tu as une aiguille?
Dr. Jonathan, we have 7 minutes left.
Okay.
Yeah.
I think with one cannula, in this case, you can treat all the external port, the nasolabial fold, the marionette lines, and these ports. Now we're going to go on the bone contact. We know we have our artery, fascial artery here. So we're going to put on the bone contact here and inject our product.
This is a volume?
This is intense. It's the same cannula, not the same syringe that they here for the nasolabial fold.
So it's intense you're injecting here?
Yeah, yeah, I inject the intense on the bone contact here. I make just 1 point here, and sometimes another point here to have a better effect. Okay. So now, after the volume on this part, on the cheek and the on the malar fat pad, after the intense on the nasolabial fold and the marionette lines, we're going to use the soft. The soft is the less volumizator treatment of Yalugen. So I'm going to take the same hole with the 25 gauge cannula. You can take 27 if you want, because it's a the product is very sweet. But I prefer to take the 25 because it's stronger and you can use it very easily. So now when you treat this part, the superior lips, with this treatment, the first treatment is to put just a few volume on this part. Our patient has a tattoo, so we're going to put just a few volume, and after to draw her lips. So ouvre la bouche. Encore. Voilà. So the first treatment, we're going to open the mouth. Encore. Ouvre la bouche. Parfait. And to put our cannula here, directly on the muscle. We are on the orbicularis muscle, on the red lips. I put my cannula here on the philtrum and going to inject on the inferior part the soft of Yalugen esteem. Generally, I inject 0.2, 0.3, depend on the patient, it depends on the anatomy. Okay. It's a very cool product, and you can touch it and to harmonize the product.
Anyone will like to ask any questions, because we are just about to finish in another 4 minutes.
Okay, so
3-4
now,
minutes.
so we can see the better effect. We have just a few of them. Souriez. Okay, and once you smile, we can see better taste here.
We can see.
Yeah, and now we're going to finish with the soft on this part. Donc on va prendre l'aiguille. To sculpt the red lips, I take the needle, and with the needle, I'm going to put this part. I'm going to respect the external part, because if you inject in the third, in this part, we're going to have not a natural effect. So I need to change my position. Okay. So, ouvre la bouche. Very important to take the needle out. Here, I'm going to make one injection here and one injection here, and we're going to respect these parts. It's very superficial and in a retrograde. Okay, fermez la bouche. Fermez. And with the patient, it's very easy because we have the tattoo, and you can feel the tattoo. And to have a better effect on the upper lips, we can make an injection on the philtrum too. Ouvrez la bouche. Okay, fermez la bouche. Perfect. Now to finish with the soft, we can use the product very superficial on this part. That said, I don't use the needle on this part because we have the facial artery close to the muscle. But if you want to have a better effect, you can inject very superficial with the needle on this part with the soft, you have two products, the intense and very deep, and the soft, more superficial. Non, je vais prendre le soft à l'aiguille.
So Jonathan, you want to demonstrate some other area or?
No, I'm just going to finish on this part.
Okay.
And that's okay. Ça va? Tournez la tête. Parfait. I just want to inject here.
I think this can be the last thing to demonstrate because already.
Okay,
we
yeah,
are
okay,
just-
I understand. I just want to show one thing. On this patient, it's very important to analyze the dynamic because, sorry, this patient, we have this part, this anatomical part, and if you want to erase this wrinkle, it's not a wrinkle, but if you want to erase it, you have to block the zygomaticus. Of course, it's not possible, and it's the charm. So it's very important to respect the charm of the patient and to respect this part. So it's not possible, and I don't want to inject this part superficially, and it's very important to respect the emotion and dynamics of the patient. I think that's okay for.
Thank you very much, Dr. Jonathan. That
Thank
was
you.
a beautiful demonstration.
Thank you very much.
Yeah.
Thank you, doctor. What's the depth of the second and third injection in the cheek? You were
In the cheek,
Yeah, okay.
yeah.
The first one on the bone. The
Yeah,
second-
you have the bone contact. So we have the skin, the superficial fat, the orbicularis muscle, very, very large. We have the SUF, the suborbicularis ocular fat pad, and it is very important to inject directly in the bone, because when you inject in the bone, you're going to avoid all the nerve structures, the artery. It's very important to know the anatomy of this part. So I take the pupil in the line, and we know under the pupil we have the infraorbitary nerve. So it's very important to avoid it. So the nerve is just here, and I take 0.5 millimeters on the external and 90 degrees and directly on the bone contact. So on the bone contact, I'm external than the nerve, and I can avoid all artery or nerve here. And if you want to inject all the cheek, you're going to take your zygomatic arcades and to inject in this part. And it's very important to be very deep on the bone contact to have an effect of lift effect. If you inject very superficial, you're going to inject here and to have this effect. You're going to have a ptosis of the product because you're going to have a bad effect on the nasolabial fold. So that's why I think the first treatment of the nasolabial fold is to inject in this part to make a pillar, a constriction on the cheek, and after you can inject this part. So on the bone contact directly here, you can lift to have a better effect. If you inject direct like this, you can have your product under the arcade. So lift the arcade, inject on the bone contact 0.2, 0.1 R2, it depends on the patient, and 0.1 on the external. And after, you're going to take your product like this to have a lift effect. But here, the first treatment is to cut the adherence, very superficial. We have adherence between the muscle and the skin, and we're going to cut adherences between the skin and the muscle. This is, I think, the best treatment of the nasolabial fold. Only if you cut the adherence and put some water, it's not the effect, but you're going to have a very good effect. So we're going to cut it to put very deep on the bone contact here, on the piriform zone, to improve this zone, to have very good effect on the light. Because when you inject here, you have volume, you have projection, and this projection is very important for the light. You know, it's very important to inject in the different part, like photographs, because we want to have very good effect with the light. So in this part, very deep, bone contact, we avoid the artery. You can inject with a needle, but I prefer to use the cannula. It's more safe. And after, you can inject with the intense, the same product, or another like the global or the soft, very superficial. On this part, you have on the depth volume, not intense, but it's more volume, and not superficial on its sculpture. It's the same with the lips. On the muscle, you can put you can put some volume, you can put 0.2, 0.1, and with your needle, very superficial, you're going to draw your lips, you're going to draw your red lips, and like with tattoo. And when the patient puts some maquillage on the lips, we have a very good effect.
Thank you, Dr. Jonathan. I think we can end up the session here.
Okay.
Thank you so much.
Thank you very much.